for joining us today. I'm Zwakele Mwango, who chairperson of Actionsa Kwazulu-Natal, and a councillor eThekwini Mabesh. So next to me, I have Dr. Hosi Lehlape, who's a member of Parliament, who also serves on a committee, portfolio committee of health nationally. And I must say, again, Dr. Inyanga is a doctor by profession, a medical doctor. He has served as a doctor for more than 44 years. Now, I'm sure you can appreciate the experience that he brings, especially to the portfolio committee of health nationally. As you all know, today we are here just to give you a brief in terms of the action step around the issue of medication shortages in KZN. So one must start by stating where this started. After we realized that there is an increasing shortage of medication in KwaZulu-Natal, we then engaged the MEC of Health. I wrote to the MEC on the 2nd of February, and the intention of my letter was really to ask the MEC if she is aware of the challenges that we are facing in the province, and also to check if there's any contingency plans to address the issue we are facing. Obviously, when you expect the MEC to come up with a plan, it means it includes to say if there are issues of budget cuts, because what I was getting from the ground was that management were told that the shortage would be addressed after 1st of April, when there's a new budget coming in. This is what I was hearing. It was based on allegations. Hence, I wanted MEC to confirm it, whether it is true or not. So after my letter to the MEC, unfortunately, the MEC decided to label my letter to her and my statement on this issue as a fake news. So meaning she was refusing to accept there's a problem in KZN around the issue of drugs that we see every day. There's a real shortage of drugs, but she believes there's no shortage of drugs in the province. So I then decided to write back to her on the 5th of February, when one, in their statement on social media, they were saying there is no such shortage in the province. They don't know anyone who ever complained about shortage. They don't even know any facility with a shortage. I then asked the MEC to say, I'm availing myself to the MEC to take her on the ground, because clearly I realized she was speaking on a position of being in an office, not understanding what's happening on the ground. I offered to say I can take her to do oversight to public clinics and hospitals so that she can see for herself. Because I always believe that sometimes with allegations as leaders, we must go out there and see for ourselves. Unfortunately, the MEC didn't respond to my call. Again, she decided to go with the officials to go around doing this sketch they were doing, taking photos, taking video clips, claiming there's no problems. Unfortunately, she went to a depot with the depot pharmacy manager saying there are the boxes, there's medication. Whereas we never said there's no medicine at depots. We are saying there's a shortage at the clinic level and hospital level throughout the province. And she was not addressing that question of clinics and hospitals, but decided to go and do that sketch. Maybe she wanted to be an actor, we don't know. But then on the 10th of February, after realizing that I don't get joy and attention from the MEC to address this issue, because she was continuously in denial, I then wrote to the Premier. And the reason why I wrote to the Premier basically was to say to the Premier, there is a challenge, and your silence as well as the Premier is loud. because it was worrying to us that the Premier of the province can be so quiet on such a crucial matter. I understand the MEC is responsible for the department, but then when the MEC continue to deny such a crisis, because I must say, we move from having a challenge, we are in a crisis mode. And I'm saying this not to cause panic. I'm saying it because we must be honest as leaders on what's happening on the ground. So the Premier have not yet responded. And again, what I was asking from the Premier is to say, Premier, can you engage with the MEC on this particular issue? And can you also, as the Premier of the province, engage with National Treasurer and the President if there's really a shortage of budget, address the issue of budget? Because we can't keep quiet when likely people will end up dying. So I can't say people have died yet, but people are dying every day. We don't know the cause of why people are dying. But bottom line is, people are dying in the province. We don't know whether it's now relating to this issue of medication or not. But all I can say is there is a real shortage of medication. And to what is also a pragmatic issue for us is that there was a circular called G77, which came out last year. And this circular was actually talking about the challenges of budget and financial constraints in the province. But it's surprising the MEC is not being honest again about that circular that was sent sometimes last year called G77, which was then signed by the former HOD Shabalala. So the MEC must talk about the circular, what it meant as well. It was a circular that was circulated, again, a memo in one of the hospitals on the 15th of January. This memo was specifically telling nurses and doctors to say the shortage of medication, they must find ways of addressing this issue where they can able to go to other hospitals or clinics to check their available stock. But bottom line is, they were saying there is a shortage of medication. So hence I'm saying we have moved from having a challenge. We are now in a crisis mode. And it's for that reason also I get worried when I see lack of oversight from members of legislature, because you've got 80 members of legislature who are elected, getting paid to do their job. I understand why the MEC will keep referring to us as, but why a councillor will talk about issues in the province. But the bottom line is, yes, I accept we are not in legislature, but we are in South Africa, we are in KZN, we are leaders, we can see what is going on. And the big question will go to members of legislature to say, when are they going to play their oversight role? And why are they silent? And their silence also speak volume. And I must say, it was surprising also to see a letter from someone, the chair of a committee, Imran Kika, from the DA, who on his letter, firstly, he criticized us for writing to the Premier. But again, when you read his letter again, he accepts there's a problem what you are raising around medication shortages. So for me, it was confusing later because he corrected himself. Maybe he didn't understand where it came from, why we wrote to the MEC, but it's for him to address that. But one must say as well, reason why we asked the MEC to resign is on the basis of the fact that, one, the MEC signed the oath. And when you sign the oath, there's a code of conduct in terms of the ethics now for members of council. Now, a member is expected to show high level of integrity and honesty and transparency. When you look at the statements that have been issued and stated by the MEC herself, it shows the MEC have lacked integrity by denying and not being transparent as well with the public. When the oath clearly states that she must be transparent with the people, and she failed to do that. It's for that reason we believe that on that basis, the MEC failed in terms of the constitution of this country, and she must just do the honorable thing by resigning. I understand she did say she can't be told by us to resign, but bottom line is, if she can speak to her own conscience, the department that she's leading, I have no doubt she has failed dismally, and I don't want to get into detail why she was even re-elected after failing on the first term. But again, it shows why it's so important when we appoint people on merits, people who understand what needs to be done. To take someone who doesn't know anything about health and expect a person to lead such a big portfolio, it's really a problem. And I think before Doc go into detail in terms of what we found on oversight, we did an oversight because despite listening to patients, what they were sharing with us in a private inbox, on our walls, including the page for the department, we decided to say, because the MEs is not prepared to go with us to do oversight in these hospitals, let's do this oversight. We've managed to cover 3 districts in one day, in 2 days, yesterday and today. We did Zululand, but we managed to do Kwanongoma Benedictine Hospital. We also managed to do a Show Hospital in King's Trial. And then this morning we went to Stenga Hospital, Kwazulu-Natal now hospital. So, but one must conclude by saying, on my side, this issue of medication is real in this province, and we are in a disaster. And I'm hoping when the president listens to this press conference, can really assist the province, because it doesn't help to have people playing politics. This is a serious matter. And I was expecting better from the Premier and the MEC in addressing this crisis. And I must share one story that yesterday I got a call from an elderly person, ugogo. Ugogo uthi uye King Dinizulu Hospital, uphethwe izinyo, and ufike lapha ngo-7, and ubamcheck ukuthi izinyo liphi elinenkinga, balithola izinyo elinenkinga, but uthi bawu-200 mayesho mayebala nje abantu bekhona mayichaza ugogo. So what she's saying, they said, okay, they now can see which is your favorite keep. But i-problem njengamanje ababhekene nayo ukuthi abakwazi ukulikhipha izinyo lakhe ngoba ayikho imjovo yokuthi bakhiphe izinyo. Engicabanga ukuthi kuqonda ukuthi uma ukhipha izinyo khona imjovo ejova ngayo kuqala ukukhipha izinyo. Kuthiwa ayikho nje esibhedlela. So mayebuza ukuthi-ke mhlawumbe sibuya nini esibhedlela eKing Dinizulu, into yayizolo le, kuthiwa cha asikwazi ukunika ama-dates nama-appointment ngoba asazi ukuthi iyoba kunini imjovo ibe khona. So now that shows ukuthi we really have a serious crisis if elderly people will be turned away just because of the shortage of medication, while the MEC is in denial. But I will hand over to Doc to take us through Uguti what he was able to pick up during our oversight. Over to you, Doc.
Good morning, and thank you for inviting me to your province to come and see what is happening. And it is quite disturbing. I think the first problem that I have is when officials are not truthful about the reality on the ground. The fact that there's drug shortages is there for everyone to see. Most people have family members that will tell stories of no drugs. Just before we started, I walked into the clinic behind. There's a beautiful facility in there for chronic medications called a CCMDD. And it's something that works beautifully where people come here, patients come here to collect their chronic medications. They don't have to go back to the hospital. But ever so often, every second person or other person that comes to collect medicines, in their packet, there's a slip that has been put in to say the medications are not complete. There's a missing medication. And the person that's in there just informs the patient that there's a missing medication, you're going to go back to the hospital. Now, that's a massive inconvenience for the patient. Now, you don't know how important that medicine is that's missing. You now have to, on your own, go back to the hospital to get that medication. If you go home without that medication, who knows what the impacts are going to be on you? So that there's a non-professional way of dealing with these challenges. So even when people know that a medicine is missing, they should be doing the professional work of what is the impact of that missing medicine on the care of the patient. There should be a preemptive effort to cancel the patient, not for them to come and collect medications and be told go to the next step. Now people have to understand that shortage of medicine is a health crisis. There are emergency trolleys in wards that don't have complete medications. When we were in Nongoma, we were told a story of lack of cyclocapron, which is a drug that is used to control bleeding during delivery. Now, when you do not have that drug on the trolley, it's basically negligence. So the issue of shortage of drugs should be taken seriously by all of us. And the reason I came is because tomorrow it's a budget speech. The Minister of Finance will be giving budgets to the different ministries. Later, there'll be a health budget speech. And I want to be able to advocate for South Africans about the needs in our healthcare system. Now, when we have fellow politicians that are economical with the truth about the challenges on the ground, that creates a problem in terms of how we can intervene. That is why on those bases, we as Actionsa have written to the Human Rights Commission to urgently investigate this matter. You hear of pharmaceutical suppliers that have not been paid for months, that have stopped deliveries for drugs. You hear of pharmacies that have 55% stock out. 55% of the drugs that should be there are not there. This is a crisis. And I would expect the MEC of Health to be the one that is shouting at the top of her lungs about the shortages that are on the ground. Concerning things is that at Benedictine Hospital, we were met by the acting CEO with the acting clinical manager. When we came down to Eshowe, we didn't have time to go into the hospital. This morning, we went to the hospital in Stenga. We were met by an acting CEO with other actors in the senior management team. So clearly, there's a leadership crisis in the healthcare system. Clearly, there's a human resource crisis. So it is not just at frontline level. It is also at management level. In Nongoma, you have a hospital with 14 clinics. You have 23 wards, which means there's 9 wards that have no clinics. You have 8 mobile clinics. 5 are incapacitated. Only 3 are working. Now, these 3 are being told on a day they should do 3 stops of a mobile clinic. Now, the challenge they face, given the false information that has been put out there that there's no shortage of drugs, they are now blaming the frontline health workers for shortages of drugs. Because they are saying, our leaders are saying there's no shortage of drugs. You are stealing the drugs. You are not giving us our drugs. So the misinformation is putting the lives of our healthcare professionals in danger. It's making the working environment not safe. So I am pleading with the leaders in the province for them to be truthful about what the situation is on the ground, so that we who are in parliament can plead and intervene on their behalf that health be properly resourced. Now, something that is also alarming, it's for me as a doctor, the lack of empathy, the lack of compassion from the leaders. It's like they're not dealing with human beings. And that is extremely concerning. We have shortages of staff. I'm told that there's a plan in Eshowe where nursing assistants and staff nurses will now be in charge of wards. When you have professional nurses that are not employed. All of us remember not so long ago, the Minister of Health saying to unemployed young doctors, go into private or go overseas. That is not acceptable. That is totally insensitive. That is poor planning. Remember that some of those young doctors that are now not employed were actually sent by the government to go and study in Cuba. And we now can't absorb them. And we have a need. Something is wrong with how our health budgets are managed. You should have had a proper budget for your drugs for the whole year. What we need to know is, was there an insufficient budget? If not, where has the money for the drugs gone to? Someone needs to explain. We will be asking the chair, I will be requesting the chair of the Health Portfolio Committee to ask the ministry in KZN to come to the Portfolio Committee and explain to us what is happening. We want the minister to be there to explain to us what is happening. What we need to consider is to ensure that health is made a national competence. So that as an MP, for all these issues on the ground, we should be able to hold the National Minister of Health accountable. But he is going to tell us, oh no, I've passed the budget to the province. It's the province that is responsible for that. We got too much administration and very little money going to where it is needed. I mean, in Stanger, I got to the hospital. We were received. We went to sit with the acting CEO, who told us what we were told in Nongon, that you can't do a visit without the province knowing. You need permission from the premier. I said to them, I'm a national representative and I have a responsibility to do unscheduled visit, unannounced visit. Said, yes, but our procedure is that your unannounced visit should be announced to the MEC, and the MEC must give permission for your unannounced visit. I will be taking these issues with the Speaker of Parliament, with the President of the country, that as elected representatives, as public servants, we need to be given access to know what is on the ground. Clearly, what has come up is that we cannot trust the information that comes from our fellow politicians. What has come out of the MEC of Health in KZN is unacceptable. And what you see, it's a lack of the basics in health. So I wonder what criteria is used to appoint MECs of health, whether competence in health management and on health issues is a prerequisite, or that is inconsequential. We need people that understand the discipline, that understand the ministry, that can be proper custodians of that ministry. What is happening is totally unacceptable. We have litigation in the public sector where we're losing money to being sued. And it's precisely because of issues like this where you have establishments that are not fit for purpose. What's the use of a hospital that doesn't have a full list of the drugs that it needs, including emergency drugs? When you cannot relieve pain, those are acute medicines that are needed. This is a crisis and it requires urgent intervention. I will send a note tonight to the Minister of Finance to say to him, we have a crisis. So all the fanciful monies that are being apportioned for pilots, for NHI, which will come in 8 years' time or into 2029, we have a crisis on the ground now. We need resources to be mobilized to the provinces so that life-saving medication should be made available where it is needed. It is not something that can wait for NHI. It is not something that can be postponed. We need to get to a point where all lives matter. And I will be challenging my fellow MPs that until all of us use the public service for our own health and for our family's health, the problems will continue. We need to ensure that ordinary South Africans understand that when they are given quality health care, they are not being done a favor. And we need to ensure that as public servants, we go where we want the voters to go for their health care. If we can't do that, then we are not honest leaders. Then we are worse than the system that we have replaced. I want to plead with all the leaders in our institutions. When we come as public officials, give us access to the facilities. We will not impede your work, but we need to know what is happening on the ground, uncensored, unfiltered, so that we know what interventions need to be made. I cannot come as an MP coming to help South Africans and be blocked from entering a facility. That is not acceptable. If it is unannounced, why would you want the Premier or the MEC to give permission? As long as I can show you my credentials, I can show you my ID, I can show you my credentials from Parliament, it should be sufficient for me to be able to know what is happening on the ground. We will continue to do oversight visits, even if we get thrown out. We will continue to do our work so that we know what is happening on the ground. And these issues are matters of urgency. Drug shortages and staff shortages are a medical emergency. And instead of leaders not being truthful about the challenges that are in the system, instead of leaders not asking for funds to recruit the necessary personnel, they now don't have excuses. They can't say there are no nurses to employ. They can't say there are no doctors to employ. They can't say there are no pharmacists to employ. We have healthcare professionals that are out of work. We need to make sure that our young people are not discouraged from getting an education, getting a profession, because we need to make sure that they need to be able to be absorbed in the professions that they have chosen, where their services are needed. I can assure you, as an Action SA MP, when I sit in Parliament, I don't represent the party. When I sit in Parliament, I sit to serve all citizens of this nation. The colors are for election time. But when you get into office, you should serve the people of this country. That is the motto of Action SA. Those are marching orders. We are not robots, and we are encouraged to engage with others, to bring our expertise. And I would like to say to the President of the country, if we do not appoint people on merit because they have the skills for the job, our problems will deepen. Our challenges, our primary challenge is not money. Our primary challenge is leadership, competence, to lead in ensuring that this works. I would be delighted. I've seen the president move security into the presidency. I would be delighted to hear President Ramaphosa move health into the presidency so that we can sort out the emergencies. Health is important for all of us, and it needs to be prioritized. And I'd like to assure the people of KZN and the people of South Africa that we as Action SA, we will do our best to ensure that being an ordinary citizen is not a crime. That as an ordinary citizen, you will get the full services that you deserve from government. We need to ensure that public services work, whether it's public transport, whether it's public health, whether it's public schools. If we can't do that, there is no future collectively for all of us. Thank you.
Thank you. Um, I think just one thing I must mention as well is that it was surprising to us that the MEC will even block the member of parliament to access the farmers. And whereas we didn't go there with cameras, with no media. That's why the media wasn't invited, because we wanted to have a proper unannounced oversight at the pharmacy level. Then the question is, if the MEC is not hiding anything, why deny us access to engage with pharmacy staff? No one knows. But also, there's the issue of cost, which I think we can downplay. Most patients we engage with, they are saying it's so costly for them to travel from their homes to hospitals and clinics to be told there is no medication, to be told we can give you 3 out of 10, you will have to come back. No one can phone you, you must come back. Then they come back again, still they're told no, there's still a shortage of medication. So it's this cost that are incurring, especially in South Africa, where we know majority of South Africans are living using grants. Now, how to expect someone ophila ama-grants ukuthi kumele ahambe every day ayozama ukuthola imithi ey'bhedlela? So yike khona le always kutholile from the ground ile yokuthi i-pharmacy ayikwazi ukwenza i-list ibe available for udokotela. I think usho udokotela manje udokotela manje prescription akazi ukuthi yini khona e-pharmacy, wenza yini prescription yokuthi udinga yini umuntu. Mayefika lapha nomuntu uthola ukuthi ayikho lento ebhalwe udokotela, akho ngisho generic, ngoba eminye ngimzwile emphathweni indaba generic. Here it's not an argument of generic. Argument ukuthi when someone edinga umuthi othize, whether khona original generic njengamanje akukho akho original akho generic kweminye yemshanguzo. So that is a serious problem esitholile masifika kubantu. But then we are hoping ukuthi this issue to be addressed, especially the issue a result doc about acting position. I can tell you, you go to most hospitals, almost everyone with management is acting. Now you can see where's the problem. Even with province man, it's worse because the HOD is acting. Now we go to hospital, CEO is acting, medical manager is acting, nursing manager is acting, pharmacy manager is acting. So everyone, no one can take responsibility. With district people are acting. So already there's a problem that you can see which EIT leadership, which address it, because no one understands which almost all these positions are nabantu actor. Why they are permanently? Hence, we are hoping, Gucci, as the doc is saying, we have now written human rights commission because we believe this is a human rights issue. You know, while the MEC keep denying the problem we are facing, people will be dying. And if Abandon actually meets better, obviously the next step will be those are shown. Yeah, but I know MEC was challenging Oguchi, where is the proof? Obviously, there's no proof but it brings Oguchi as Abandon be spend of meeting at Tolumuchi. Was a spend of no season or to see. So Umotolo sees Lomiti, then Bessie are shown. Then even families will end up concluding Gucci. And I think MEC must understand how this thing is so serious. And I don't even think the thing was just Parliament question Parliament, this is bylaw president. In everything I know pay me province. To be honest, I always say so if you no more cola, no one can help you when you are sick. So the MEC German that at that level where the MEC is failing to acknowledge Uguchi, she has a problem in the province, and this problem requires intervention from national. Now, and that intervention also in Mali. And I must say also we also engage with some of Abandaba supply medications. And who confirming would have been owed, by the way, by department. And some are saying we can't deliver anymore because we've been owed from October till now. No one is paying us. We are being told to wait for April. So they are saying, but we are now bankrupt. This is why kwezinye indawo ama-security guard ey'bhedlela abapheliwe, even abantu abaphekayo abapheliwe, abantu abaklinayo ey'bhedlela abapheliwe. So these are the issues oyibonayo ukuthi zidinga intervention ye-Human Rights Commission. We are hoping ukuthi their findings and they do thorough investigation, and we believe it will be urgent because it can't wait. It's not an investigation that can wait for 3 months or 6 months. We hope they will treat this matter as a matter of urgency and be on the ground and do investigation. So I thank you if there's any question.
I just also to add that next week I'll be doing an oversight in Gauteng on the human resource side of things. And what we will hope to do would be at the end of that, we would be writing to the Public Service Commission, because these are public service issues about appointments, about posts that are not filled, posts that are not advertised, people that don't have the skills when they are in posts. All those issues need to be sorted out. There's a challenge in this country where there's an indifference to what is happening in the public healthcare system. And we want the people to pressurize parliament and government to prioritize fixing the public healthcare system and stop waffling about something in the future, a pot of money that seems to be a silver bullet to all the problems that we have. It is not the silver bullet.
Okay, greetings all. My name is Wanda Ulongi. I'm from SABC News. I just have a couple of questions. I think the first question will be directed to Mr. Mmango. Mr. Mmango, the MEC for Health in the province has labeled the information that you have given us as misinformation as well as exaggerated. She says that you are pushing a certain political agenda to tarnish her image. What is your response to that? And then to Doc, Doc, I'm sure you are aware that currently the province is experiencing an outbreak of hand, foot, and mouth disease. Information that I've just got from one of my colleagues. Yesterday we were sitting at 168, if I'm not mistaken, and today the department has confirmed that we are sitting just above 190 cases in the province. Now, with this issue of the shortages in medication stock, as well as the issue around the shortage of staff, is the province going to be able to address this issue of this hand, foot, and mouth disease? Thank you.
My question is for Dr. Natabe. Doctor, you keep mentioning the fact that you want to implore the president that if they don't hire people based on merit, our problems in society will deepen. And you've also said you wonder what kind of a protocol or what they follow in terms of hiring health MECs. Now, is this to say that you don't believe that the MEC, Melanie, is qualified for the position that she's in at the moment?
No, it's not personalized to any of the MECs. It's just a generic thing. Because one of the issues is that health is a profession, a health background, but you must do the job. Remember that you may find doctors that are there that are not fit for purpose as MECs. So it's about doing the job. Right now, that job is not being done. That stewardship is not being given. There's a problem where people become political appointments and they serve politics and they don't serve the people. And they do covers up. And what pains me is the fact that if they opened up about the challenges that there are, remember, the issue of stockouts, even if you have a health background, you are not running the pharmacy. You are not at the clinic. So there should be information that comes to you that you need to deal with. So the question is whether the MEC is not being given the right information, or the MEC doesn't care about the information that is being put in front of her. But you can also go out as an MEC on the ground and go and see what is there in the dispensaries. Speak to patients like we're doing, so that you get to know for yourself what the issue is. So just understand that it's not about any particular person. It's about fitness for purpose. Our systems should work. I mean, national health has plenty of challenges. The Minister of Health has been there before. He's a doctor. He's been a minister before. We want outcomes. We want results. I mean, our motto is fix things. And when things don't work, get somebody else that can do the job. I don't know if that answers your question. Okay. The issue of foot and mouth disease. Any infectious disease, one of the key issues is tracking and tracing. Because the key intervention is to stop the spread of the infection. So there may be issues of vaccination, issues of pharmaceutical intervention, but that's not how you break the cycle. And I must commend our department that on infectious diseases, we've been able to curtail all the pandemics that we've had. And I hope this will be no different. So the point is you go to where the clusters are, you isolate, you improve hygiene, and you spread the infection. Where you need to increase vaccinations, look at the animal population, look at the source, you do that. And I have confidence in the surveillance system that has been utilized by the department so far. So the lack of pharmaceuticals don't really go into that. The issue would be about isolating and where necessary, targeted vaccination for targeted populations. But it's about identifying where the things come from, where the source is, containing it and ensuring it doesn't spread, and ensuring that those that are affected are put into treatment and isolated.
Thank you. The question about product image. I just wonder if she believes she still has product image herself. I don't know. Um, I, I get that she keeps saying there's misinformation and there's fake news. Maybe it's easier for her to say that from the privileged point of view, sitting in the office, not being on the ground. And you can see now that her communication is more about protecting her product image versus protecting the lives of people in KZN. Because her focus should be about the people who are suffering because of this shortage, not her image. And to try to spin these things, I think MEC must stop spinning this, because initially it was fake news, there's no problems, and worse part of it, for the department to go all out and label such a crisis as a fake news when you are dealing with people on the ground who are feeling the pain, who know what it is to go to a hospital and to be told there is no medication, there is no job. So there's a problem. Oyibona ukuthi MEC wayena uyazama ukwenza lezi cash zakhe engicabanga ukuthi ayeke leyo nto leyo. In terms of indaba yokuthi yepolitiki, it's unfortunate, and I must say this. I did hear what you are asking about MEC. In her mind, I'm not sure whether she believes this or it's a way of trying to get a sympathy within the ANC. I must say on record, I have no engagement with anyone in the ANC, and their fight within the ANC in the province is their fight. They mustn't drag me to that. I haven't engaged with her internal opponents, as now she claims, or they claim, that there are individuals within the ANC in the province who are using us to fight her for whatever political gains they may have within the province. I'm not involved, and it's on record. I can say it now. I have never engaged with anyone, and those individuals who are alleged to engage with me, it's not true. I'm not involved. She must answer the question. Is there a shortage of medication in the province? Yes or no? If it's yes, what is she doing to make sure that we address the crisis? Can she engage with the premier and engage with the national leadership, in terms of president and finance, to get monies to address the crisis? As simple as that. And we must really call this as a disaster, because it's a disaster. That's where we are at the moment. It is a disaster. So I don't think it's important for her to try and shift the goalpost and to go as far as, I must say, Doc, I was saying yesterday, to go as far as creating fake accounts to try and attack Action SA and myself over the issue. Address the issue. It's unethical, even on that you go as far as mobilizing staff members to create fake accounts to attack someone who's raising a real issue that affects on the ground. So I don't know whether she still have an image. I think the image has been dated by herself, by lying to the public, failing to be honest, and failing to be transparent with us as the nation to know exactly what's going on. Yes?
And the food tolerance ukuthi since you guys have been on the ground and when we were doing the report with the MEC, she said like it was maybe I was 99 so by the management team on the ground now also are they able to do that response?
Yeah, no, it's true. We did get that. In fact, wonke ama-facilities sifike kona, we did get ukuthi imithi bayithola kwezinye indawo, like if ingekho eklinikhi ethize ikhona yini or esibhedlela, to a point where I'm not sure ngoma where isibhedlela now rely kuma-clinics. You know, you'd expect isibhedlela just to supply ama-clinics, but khona isibhedlela sangimeshona ngoma where
It's a no where there were fluids using alcohol.
Yes.
But
So now
from the
isibhedlela end up relying kuma-clinics okuyisona esisapplaye wona. So now they have to check usenakho lisa back futhi thina because sine-shortage. So bayakwenza, and also they even go even outside iy'bhedlela kwezinye, for example, I know ukuthi kwaNongoma they were saying kunemithi abade beyond the show Fryhead. So meaning they go even beyond uNongoma, they go to Fryhead. Fryhead uma ungenakho kunyuweza ngalana kanjalo they cross. But issue ukuthi njengamanje khona imithi ihamba iphela ingasabikho, kodwa le eminye besakwazi ukuyithola ngapha ukuthi bayithole ngala ingabikho. Kodwa iproblem ilana ukuthi umuntu uma efika esibhedlela umuthi usuke udinga manje or usuke edinga usizo manje, and uma uzoyilanda, someone even said kwaNongoma enye iprogram anayo ukuthi kuzothiwa umuthi is available kwaNongoma isibhedlela futhi imoto ifile. Even ama-ambulance the-charges enzetshwayo asawu-3 ama-ambulance. You can imagine i-district onomasipala more than 3, but ama-ambulance awu-3 kwi-district yona. iZululand i-ambulance asukela Olundi. Now imigwaqo gravel already kufika kwenye indawo, kufika lapho kwenye indawo nje kuba difficult. Omunye nje uthi kade ehambise naye ube usebenza khona esibhedlela, ubehambise umkwazi wakhe eklinikhi, udinga ukuthi afakwe i-drip, wasuthi i-drip ayikho eklinikhi. Ngokuthi sesibhedlela wakwazi ukuthola a-fast access kwi-ambulance, but uyasho ukuthi if bengeyena ubengasho umkwazi wakhe ngoba nje bedinga i-drip eklinikhi. Uyacabanga ukuthi isimo singakanani-ke ukuthi but uyayilida i-drip. So how do you wait for i-drip esuka e-Fryhead ize kwaNongoma eklinikhi konjoke? It's far and also gravel road. So yilo inkinga ekhona-ke esinayo yani. Are we good? Thank you. Thanks everyone for your time. We appreciate